Welcome to Ideagen TV. The 17 days of sustainability concludes today, live from the NASDAQ. We're excited to have our good friend and partner at Ideagen, BJ Moore from Providence, joining us live from Seattle. BJ, welcome.
Thanks, George. Fantastic to be here. Appreciate it.
There are many people, BJ, that are attempting to change the world. You're one of them. And we're honored to be working with you and to be helping to amplify the absolutely incredible work that you're doing at Providence to transform, to reimagine, to simplify, to modify, to do all the things necessary for the delivery of healthcare to ultimately transform that delivery into a way that's more efficient and more effective, quite frankly. And you're, again, at the front of that. There's certain areas that also come into play, like sustainability. And I'd like to ask you, BJ, why is sustainability, especially for healthcare and healthcare facilities, so critically important?
Yeah, so first, some context for you, George. If you look at the entire health systems within the United States, health systems, which include Providence, represent about 10% of the greenhouse gases within the U.S. If the healthcare system in the U.S. was a country, we would be the 9th or 13th largest, depending on how you count it, greenhouse emitter in the world. So if we were a country, we would be the 9th largest or 13th largest. And so it's our responsibility to give back to our communities, protect our communities, and because we are contributing so negatively to greenhouse gases. So it's our responsibility to reduce that. And here at Providence, we've got a number of social responsibility pillars. Sustainability is one of those. And our CEO, Rod Hochman, has set a very bold goal that we will, as a health system, be carbon negative by 2030. And so a very aggressive goal, but it represents how Providence is giving back to our communities, being a steward of our environment, and really leading by example.
Well, that's right. You are leading by example, and we see it. We see it each and every day. And I want to commend you and Dr. Hochman and Dr. Meadows and all the incredible colleagues that you have as part of the team at Providence, leading the way. Because after all, we believe that leadership sets the tone, allows for that engagement and impact to take place. And so as we look at that, Providence is also a leader in partnerships.
Yep.
A lot of people may not realize that Providence has been at the very, very front edge of the bleeding edge of transformation, as we talked about in healthcare, and also on partnerships. And today is befitting of a discussion on partnerships because goal number 17 of the UN SDGs is all about global partnerships for the goals. And so there's a term that we like to coin here at Ideagen, which is dynamic resiliency. When you Google or you Wiki or whatever way you search.
Bing.
Yeah, Bing.
A Microsoft plug.
You Bing, if you Bing and you Bing and you Bing again and you say dynamic resiliency, when you Bing, you see Providence come up. And why do you see Providence come up? Because you have this uncanny ability, a focus, deliberate focus on partnerships. And these partnerships are what have helped you and helped you each and every day, and what we're so excited about for you for the future, to drive and peer around those corners, especially at this moment as we see this unprecedented global pandemic. Providence has led. You're leading. BJ, why are these partnerships and why is this commitment to partnerships so critical, especially when you look at it through the lens of a dynamically resilient organization?
Yeah, we're a large health organization, one of the largest in the United States. But in spite of our size and breadth in our communities, we can't go it alone. So when we look at partnerships, we look at a diversity of strengths, the strengths that we bring from Providence and the strengths that a partner can bring. And really through those partnerships, can be a win-win. We're better together. So Gretchen and I in a little bit will talk about the Microsoft partnership. And that's just a great example where Microsoft is bringing their technological strength and we're bringing our clinical and, research strength to bear. And together, we're better together.
That's right. And that's just one example, a great example that we'll be talking about shortly on these partnerships that Providence is so committed to. And by the way, partnerships that began before this global situation. And that allows you to really thrive and not only survive, but thrive in some ways in helping to affect that change.
Yep. Yeah, I mean, the key to partnerships is to do it while there's not a crisis, right? So the Microsoft partnership being a great example. We struck that, July of 2019, well before any of us have heard of COVID-19. And, we built that deep partnership. And so when the crisis came, we had that resiliency that you talked about. And not only were we able to build upon the strength of that partnership, but the partnership actually grew stronger. For both Microsoft and Providence, we both leaned in together to tackle this COVID crisis.
Well, BJ, we'll be back in a few minutes with you and Gretchen O'Hara from Microsoft to talk more about all of these important issues. We'll be back in a few moments.
Excellent. Thanks, George. Looking forward to it.
Thank you.